6:05 p.m.
Okay, meeting is recorded.
Kristen, do we have minutes?
I believe I sent them in the email.
Let me see if I can find those.
Yeah, I did take a look, so I'm ready to vote whenever you guys are.
Oh, I see. Okay, I got it now. Let me
Oh, I have not.
I'm booting them up right now. I'll give them do we need to do any mail review?
Quite a bit of mail this week. We did get a lot of water reports.
Yep, I did take a quick peek
Year
at
end,
those.
so it's just, some of them are the full reports, some of them are just the cover sheets for the school. Some of the, Century Mill Estates is in here. There's actually 2 separate ones in there for them. That was not a typo on my part, but I didn't go back to see what it was. Again, I get all of these either electronically and or mailed into me. So if you ever need a copy of something, I am happy to pass along, whatever copy, but there was quite a bit of water reports that came in. And that's why that's the majority of the packet in the mail.
Yeah, okay. I saw that. Very good. Then that being said, and we have no appointments, let's move on to action discussion. And our number 1 and only reoccurring topic, coronavirus.
So I have a few things for this week. As of January 7th, last Thursday, Bolton went to the red, meaning we have more than 25 total cases at this time. So, per the state guidelines, it doesn't necessarily mean anything at this time because the entire state is on the same level. The governor did announce that the rollback would continue through January 24th, 2021. And again, not much changes for the town. A lot of that has to do with movie theaters, more of event venues like that. So we will continue on as we are.
Sorry to interrupt, Kristen. The 25, is that over what time period, or is that just active?
It's active, and then it sort of rolls it into 2 weeks. So the week before, on the 31st, we had a pretty significant increase. I want to say it was like 18.
Yeah.
Top of my head. So, really all it was going to take was 7 more cases for us to go over that number this week. So while we had a lower number, when you combine the 2 together, some of those other cases have not fallen off. So it's 25 total active cases right now.
Okay.
So hopefully.
Excuse me?
Is that
Excuse me? Yeah, I just want to make sure you can hear me. Is that?
I can hear you. Yeah.
I'm sorry to interrupt. Okay, great. Because I can't figure this thing out. Okay, carry on. Sorry.
I just have to rename because you're on here twice, Joan, video and phone. So I take it you're calling in from a phone.
Just a phone, because forget it. It's my second time on Zoom, so I'm just jumping in. Hello?
Okay. Yep, we hear you.
Okay.
And so again, the rollback will take place until the 21st. And then hopefully if we have a small week of number of new cases this week, Scott, we will go, I would assume my best guess is we'll go back down to yellow. And then eventually we make our way to green. There are not many cities and towns in the state that are not red at this time. And I do know that the Bolton first responders are starting to get their vaccines and cadets. So I think that's great. That started well, today's only Tuesday. It started yesterday. So they are in the process of that. I did email Jim again today. Bill, I don't know if you have any other information, if he has any updates with a vaccine plan for the town of Bolton. Is it, we still lumped in with them. So again, I'm happy to take that offline. I'm just very curious as to where we stand with that.
Yeah, I'm aware of is the first responders clinic that's set up in Boxborough.
Yep. I do know that Fire Chief went to Leominster Hospital. So that there's some, some local options for them to go to. And on the DPH call today, they went over the vaccination timeline. Again, no real big changes.
Right.
The last couple weeks, the only big changes, they keep toying around with that 65 to 75 age range. So it's that's all I really know at this time as far as vaccine, but I will continue to follow up with Jim, and if I'm happy to talk to him. I don't know if we need to have another one of well, that's actually on my list on the agenda as well, the emergency dispensing, so we can go over it then too. But that is all I have for coronavirus.
Could you make sure to just plug me in someplace wherever you can, because I don't know your process. First meeting I've attended.
Okay.
But Joan, let me ask you very quickly, what do you want to talk to the board about?
Coronavirus.
Okay, well, we're on that topic now, and so we've concluded our piece. What can we do? What can we say, or what do you want to tell us about coronavirus?
So I know everybody else's point of view. I'm just wondering if there's anybody but myself who can or has spoken to a less popular viewpoint in regards to it in our town.
And what would that less popular viewpoint be?
I don't think we have.
Well, I am a nurse, so I do have some hands-on information, and I think it's worth sharing. But it's not, as I said, a popular viewpoint. So I'm just wondering, first of all, yeah, I'll get to it. I strongly oppose the mandates that are affecting our town and our lives, and I think we all say, yes, it is adversely affecting us, but we're still in it. So I'm listening to the numbers at the same time I'm trying to log on here, and I know we're in the red, but we're a town of 6,000 people or so, and I therefore think those numbers are pretty positive. And as I said, I'm a nurse. I value life and all that, but I also value our being together. How's that? And it is the keeping us apart, covered and alone, that concerns me greatly, for personal reasons, for physical, the physical health of our town, the mental health, and the economic health. So I'm wondering if you want to hear more about that and my viewpoint that they are actually absolutely horrific and inhumane to continue. And if we have to, is there any pushback against them, except for me?
Well,
I don't know that the local board of health has the ability to resist or go against a mandate that's set down from the governor. I don't know if the other board members care to weigh in, but I don't know that local government can ease up on what's being mandated from the state level.
No, I don't think we can. And I'm hoping that if we do tolerate and suffer through everything you've mentioned, ma'am, and a little bit of vaccine, we'll get to the other side of this and get the living. But the longer we sort of deny it and spread it around, the longer and more painful it is. I am a survivor. I spent my 3 weeks in the prison system, they call it solitary. In my room alone, gowned nurses and therapists who did a great job. Other than that, those are the only people I saw. And it wasn't fun, but I thank them very much as I came back out live. But yes, you have a very good point that if this is going to be a long-term situation, this was our new society, we ought to look for some better way to do it. I'm hoping in a couple of months, and perhaps by summer, we won't have to put up with any of this nonsense and go back to living. That's been my position and why I've cooperated with the lockdowns that have come forth.
I'm glad you recovered, and I did too. And for 2 weeks back in March, I supported what appeared to be drastic measures. But a year into this, I'm strongly against them because, as I say, I work in a hospital and see the effect it has there, but I also know I'm not immune to it right here in my own home on Manor Road. So I have an extremely different viewpoint. I see, you know, I don't see any surge. Haven't cared for a COVID positive patient yet, and on it goes. And the story is very heated and sensitive. But I think it deserves consideration because there's no other opinion out there but the more popular one. And as a member of this town and an experienced nurse and a person who values life as we all do, I want my voice heard in this process as well. So I'd like to share it, but I doubt if you'll let me. But if I can then skip to what are we doing for good health? If we have to live on Zoom, in my opinion, we're doomed, because this is make-believe and this is horrific. What can we do to bring people together and do our own work toward, pushing back against isolation and loneliness and despair? We're 6,000 people. We're a wealthy community. Most of us are unaffected by this and have room to wiggle and can sit pretty comfortably here. But there are people who can't, and those are people who are alone, especially. And they don't have to be 80 to be alone. And they can be 16 and alone and 22 and alone, or what have you. We're all affected and not all accepting, even though, again, I don't have a popular view here in town. But physical health, so what can we do to promote it, bring people together, sit people together, walk people together, talk people together? I mean, why do we have to resort to this perpetuation of fear? That's one. And I'm trying to not take up too much of your time. Mental health, that we're not disconnected at the neck, and the two are connected closely. But mental health affects our immunity. It affects we live for one another, don't we? Like, we need one another. People need people close. And 2 weeks seemed fairly reasonable, but a year is catastrophic. And
Joan, I guess, Joan, I don't understand. I mean, so I've got an 81-year-old mother down the street, and if you think for a second, I would intentionally do anything to put her health in danger. I mean, I appreciate what you're saying, and I understand. I've got high school children.
Yeah.
I've got an 81-year-old mother down the road. We're all managing this the best we can. But that doesn't mean it's not there. It doesn't mean that it doesn't present a risk.
No, I didn't say that. I didn't say that it doesn't exist and it doesn't carry a risk, but walking out our door does also. But also inherent is in keeping us locked up is poor physical, mental, and economic health as well. So
Joan, I don't think we disagree with you. We're definitely concerned about the issues you're raising, but we're also really more concerned really about the people who are dying alone, whose family can't even visit them.
Right.
and it's getting worse,
Right.
not better. And that's because of more socialization around holidays, et cetera. So we've let our guard down and it's really getting worse, not better.
Scott, I don't think people are dying alone because of the mandates that restrict people from entering a hospital building. So that's me. There I am, firsthand. People
No,
are
they're dying alone because we're trying to protect our healthcare workers. They're trying to help them, and they're taking tremendous risk.
You're
You
you're
yourself
speaking
as
to one
well.
of those.
But we can
But
get hope when we can get them vaccinated, hopefully that'll help. That needs to be a priority. But
the vaccine
I
isn't
think
going
we
to
should
help those.
continue to look for ways to address some of the other issues that you're talking about. But lifting the mandates, first of all, as Bill said, it's out of our control. So, I think you need to convince the state government and the federal government and the experts at that level in order to really change the mandates.
Well, I've just so you know, Scott, I've been at this for the better part of a year, and as I said, 2 weeks I was okay, but 2 weeks after that, I was saying, "Holy smokes, this is horrific! Treating everyone as infectious is a very dangerous way to treat people," and obviously it is, because we don't, we can't be together. We're treating each other as infectious or will be. So we're at a much more grave place than we were even back in March. So the vaccine is another issue, and I don't mind talking about it, but it's again an opinion of yours, or that has been put forth, that has some controversial components to it, and no one's talking about that. So there I am, the lone wolf out here on Manor Road, saying, hold on, could we just please consider all possibilities, because the one that we're using and following is sinking us personally, physically, mentally, and economically right here in my little town and yours. So I'm not here. I'm here to help. I hope I'm here to raise the other side, my side. I'll speak about it. My side, the nurses' side, the firsthand witness to the waiting and still waiting for the surge. I'm waiting for the cases. I'm waiting to see. There hasn't been, and if there were, I would know it. It's terrifying for me to sit and hear this and yet witness, as a nurse, the reality of the mandates that are imposed. Again, we come from a wealthy, white area that is virtually unaffected. But when you step inside others' shoes, like those people who are ill, they need people. We need people to survive, be it
So
a business.
what do you suggest we as a Board of Health do, Joan?
Oh, I suggest we first begin to just think about that for a minute, because in my opinion, it's become, we're far beyond a COVID-19 infection, and we're into a political nightmare and this week we really don't have a sitting president. So it's extended to this degree that it's affected every single life across our nation, that no one can really avoid it. Just some people are more affected by a loss of business, home, loved one, etc. What can we do? We can push back and say, hold on, this is enough. This is long enough. This is affecting us. This is collapsing us. This has closed our schools, our churches, our support, our neighbors' doors. We're suffering. We need it to stop. How can we get back together and get our children's faces uncovered and get schools open and begin to live? Because we live for one another. Otherwise, why? So I'm asking serious but I'm trying to be calm because it's a passionate, loaded subject, because we've all been living with the one side that says we should be afraid, alone, and apart. And I'm saying, oh no, that's not the answer. A vaccine will help, but it's a virus. It's self-limiting. It's going to come again. It's short-lived. We don't even know the effects of the vaccine. It's scary. People in my unit are sick from it. People are getting 103 fevers, FYI. So a vaccine sounds like the answer to people who don't know, but it isn't. Really the healing will be when we can be together. And I can help you, you can help me, I can help your mother, you can help your mother, that kind of thing. I have an 88-year-old mother too, who won't visit here because I work in a hospital. She's terrified. But 88 is a long, all right, and you get the point. What can we do? Can we get people together on the town to walk? Can we get people together 6 feet apart on the town green to sing song and pray together, be together, walk together? Can we gather together to take out at a long table dinner 6 feet apart? Can we sing together? Can we do anything that brings people together that they will feel safe? And gradually, we will come together again, and it will be okay, because life is about risk and life is about living. And this virus is not going away. But the good news is 30 people, I think you said, I don't know your name. The
25.
woman,
Her name is Kristen, and the number is 25.
So Kristen, you said, I think the number was 30 in town, right? Am I correct in listening
It
to that?
depends on, right now Bolton's had a total of 97 total cases since March, and we're currently sitting at 26 for the 14-week. I'm sorry.
Okay, so 20 out of 2,000, we're good, right? 90%, let's say 90% of people don't get this, and if they do, they recover. Yes, that's positive. Why aren't we hearing that? Using it, encouraging people, supporting, give hope. We need hope that we will be together, that people won't be alone, and on it goes.
Okay, well, I don't know. I'm still not clear on what in the kind of the narrow band and the narrow mandate of our board, what we can do. I do appreciate what you're saying, but from a Board of Health perspective, don't know what we can do specifically to address what you're talking about.
Okay, so how many times can one business, let's take the Bolton Bean, how many times does one business have to wipe their counters and put up plexiglass and readjust and recalculate and be expected to survive? Bruce Slater's place is nearly empty. I mean, it's very difficult to go in there. A lively place, open mic, full of people and good vibes, and it can't survive if we don't push back. And we need services, library for elderly, for anybody, for good use, right? We pay for these things. A swim in the pond,
But Joan, aren't you proposing activities that are just going to further spread the virus?
I think there were some crazy number of millions of people who have tested positive. Crazy number. I don't know.
That's
Maybe
possible.
you know.
That's possible. I get that.
But they're all in masks. They're all in masks, Chris. Nobody's without a mask. We're all very obedient. So I do think there's some hope in that statement that I just made. It doesn't. A mask isn't going to save us, right? I believe it's a sign of fear, illness, and vulnerability, not courage, confidence, and hope. It means something's wrong with you, But when those masks,
I disagree vehemently with that comment.
What?
I look at it. I think it's a sign that you appreciate your fellow citizens and are willing to wear a mask in your effort to protect them from the virus. But I digress. We've got to wrap this up because we've got a pretty full agenda here, and have just spent about 20 minutes on this topic.
Okay.
Unless, here's what I'd say, Joan. If you have something specific that you want to address our board in terms of what we actually control in this regard, then please make an appointment for our next meeting.
Okay, can I just say, let me wrap this up too, Chris, that you guys are, I don't know how many members are here, 4 or 5, and I'm just one person from the community. So that's 4 or 5 opinions that represent the town. But I just want to remind you that there is another point of view that deserves discussion. And my objection to Zoom that I'm learning is that I can be muted or asked to mute, as if you're asking me to shut the door behind me. And I'm just sensitive to that, aware of it, and remind you that my voice matters too. And I am an experienced nurse of 40 years, and you might want to just listen. And in
Okay.
fact, I think it's important that we hear all voices from the town. We're thinking, right?
And again, and I'm not disagreeing with that, and we're not muting you, but you're kind of in an area that's a little bit loftier and higher than our kind of mundane purview here. So that's why I ask if there's something, you know, kind of specific to our mandate that we can do. That's great. I mean, you know, what you're saying, I don't disagree with. Go on a trail walk with somebody 6 feet away. I do it all the time. You know, go see my mom, sit in a lawn chair 12 feet away. Do it all the time. I do believe there are ways to manage this, but I also think that this is something to be taken very seriously. I don't want it. I have not had this. And I'm willing to protect myself and those around me until it passes. So,
And I'm just saying the
I'm proud of what the
mandate.
town has done to facilitate some of that. You know, the trails the conservation land is really getting utilized heavily. There's yoga programs, you know, so I think we should be proud of efforts that have been done by various citizens and the town government to try and address some of what you're talking about, Joan. And I think we have listened to you. We understand your point of view. And, you know, you're being heard.
Okay, thank you. Thanks for
Very
your
good.
time. I appreciate it. And I know you have other business, so
We do,
I'll
yep.
depart.
Thank you. And so wrapping up coronavirus discussion, we're going to move into new topics. EDS updates. Kristen, do we have anything in a?
No, I did touch upon that briefly.
I mean, my expectation is we'll learn more as more vaccine becomes available.
Correct. I'm just going to, before we move on, I do see that, oh, she left both calls. Okay. I was just gonna, Joan was on here twice, so I didn't want to like keep her phone going if she wasn't on, but she's disconnected both lines on this. No, so the EDS, again, emergency dispensing site updates, I don't have any. I don't know how much to, I mean, I can ask Jim, I'll tell, I don't know if anyone has any other information that they've heard. Like I said, I know first responders are starting to go. I don't believe any type of mass vaccination isn't until phase 3 of this, which is closer to late March, April, May. So, nothing that's imminent, but I want to make sure we're prepared and ready.
Sure.
When that time comes. So any updates that anybody gets, please pass it along to me. And I'll also work with Jeff.
But so you're telling me that, so you really haven't heard anything new from Jim recently?
No.
I guess, would it be worth having you check in with the 2 chiefs to see where they stand? Because I know that Chief Legendre has been a big piece of the EMTs getting vaccinated. So
Yeah.
he may have,
Okay.
and frankly, by the time we get around to the community vaccinations, they may not really have any interest or role in it at that point. I don't know.
Okay, I'll check in with Jeff.
Okay, annual report. I saw that you put up last year's, I
Yep, so
guess.
this is last year's report I put in there just as an FYI. I do have this due to Jenny by February 12th. So I hope to have a little something by the next meeting. So basically the first page here, the mission statement, I don't believe that really needs any changing. I think you guys have probably used this every year. The part that would change would be that bottom paragraph. I believe the last one, it was Board of Health and Selectmen. We talked a little bit about Triple E. So I think this year the topic of conversation would be obviously a little bit of COVID and the mosquito control program. So Scott, I'll reach it once I have that statement typed and ready. I will send to you for, I can send it to the board as well. Just so if there's anybody who has anything specific they want to say and they want me to, put it into a into the annual report, let me know. But I am working on that at this time.
Okay, that is great. Moving on to 985 Main Street, the deed restriction.
So in the packet, Bill, that's Mark Ayott's property.
This is where a room's being added, and based on my room count, brought the home to 10 rooms. It has a 4-bedroom septic system, so it requires what we would call a 4-bedroom deed restriction. I don't know if you've seen his example. Instead of saying 4 bedrooms, his attorney crafted wording that respects the Board of Health approved design flow at that time. And his attorney's previous experience, instead of putting a number on it, wants to leave it somewhat open-ended so that if down the road somebody put in a larger flow system, they wouldn't be held to the 4. I guess historically we've had them put in the 4 with the caveat that if a larger system was put in, a larger flow would be respected. So, they're trying to address that up front versus down the road. And because I had never seen a deed restriction without a number in it, I thought it would warrant discussion.
Yeah, my feeling is that all they're really doing in the clause they put in there is restating the law. I mean, all it really says is they're going to follow the law. I don't understand why they can't put in the same restriction we require. And right now it needs to be limited to 4 bedrooms. And it needs to state that clearly so that if someone's buying the house, they know it's restricted to 4 bedrooms.
Yeah, I mean, does this say anywhere on it, like what the system, for a maximum number of bedrooms? So
All
yeah,
it says is they're going to follow the law.
Yeah, it's funny because I did get I got a call that went very long with Mark about this and didn't quite understand what he was saying. This is not really what I understood. It just seems a little, here's what it says. I'm not going to say that it's not saying exactly what it should say, but having flipped a little bit of property in my day and knowing how much can be missed, don't really feel like this has, it just looks like it's too easy to blow past. That's my opinion. Now, again, I don't know how you feel, Bill or Chris or Scott. I try to explain to Mark that we do have a numbers restriction on our thing, but to my knowledge, every restriction always refers to the fact that if and when somebody wants to change that and goes to the proper channels, then that also gets added to the deed and is what's respected. Because again, everyone's going to keep in mind, nothing ever comes out of a deed. It just, always gets added to. And to my knowledge, Bill, we have never had a problem with this, at least in the 21 years I've been on this board. I don't think we've ever had an issue in which that anything's ever come up as a result of this.
Right. I guess historically, whether the board uses their very short, simple example, or you go to the 5-page DEP example that's in Title 5, either example does state number of bedrooms. So, that's why I thought it would need to be discussed, because if the board feels it does need a number, either I'd call Mark or Kristen could email him, and if he doesn't agree with that opinion, he should come to a meeting to discuss it with the board further.
Because again, at the very least, looking at this, I mean, it'd be one thing, the impression I got talking to him was that it was going to essentially reference, the David E. Ross or the Ducharme Dillis plan, dated X, whatever, but I don't, I just see a survey plan being referenced. I don't see anything here that really, if you didn't know any better and read this thing, you wouldn't know that you were committed to this, I don't think.
Yeah, I think it references, I don't have it in front of me, but like approved design flow currently on record or currently approved by Board of Health, it might even say which may change.
That's the law. They have to, so I don't know why they have to put a clause in there that states that. I mean, it also kind of defeats the whole purpose of the deed restriction, which is to make it clear that the number of rooms in the house exceeds the design capacity of um, of the system.
If you want to hold,
It's for the benefit of future buyers.
I'm going to grab my Title V, if you don't mind. It's going to run right upstairs, because if Title V gets definitive about what the deed restriction has to say, like if it references number of bedrooms, I guess at that point we'd have a solid answer.
Yeah.
I'll be back in 1 second.
Yeah, because it really is just this one paragraph that says, subject to the restrictions that so long as the above described property is served by a private sewer system, the plans for which being approved by the town of Bolton from time to time set forth a maximum number of bedrooms to be served by said sewer system may not exceed the number of bedrooms as set forth in any such approved plans. That just seems a little ambiguous to me. I don't like it.
Yeah, and I can understand why they want to do it, because if they do upgrade the system, they don't have to then go back and eliminate the deed restriction. But I think this is a bad precedent.
But to that point, Scott, so they upgrade the system. So you go to buy the house, you're not being told or directed to ever go to the town and look at the file for the septic system. Again, for me, the deed has always been a critical document because it is telling people in the future to look for something that may not be obvious to them. Now, that's a grave oversimplification of the whole deed process, but that's been our intention from day one, I think, is to give the second and third person in line from this purchase the information they need in terms of a long sewer line, in terms of number of bedrooms. And so there it is. But Bill, hopefully you found the silver bullet.
Well,
it also it also prevents people from listing the house
right
with, more bedrooms than they should.
Yeah, the Bolton regulations might weigh in on this too, but if you go to the Title V definition of bedroom, which talks about square footage, ceiling height, etc., but also brings into play the total number of rooms divided by 2 and rounding down, it says the applicant may design a system using design flows for a smaller number of bedrooms that are presumed by this definition by granting to the approving authority a deed restriction limiting the number of bedrooms to the smaller number. So that is spelling out the number of bedrooms.
Yeah.
So that last I knew, you didn't have to take that out of the registry of deeds or anything else. When you put in a 5-bedroom system, Bill gives you a certificate of completion, and you file that, which is obviously of a later date, and thus takes precedence.
That's how it's been handled in the past, and I did describe that to Mark. But again, his attorney is advising him, to use this language. So,
well, I'm sorry. That's straightforward, and the rest. And I want very straightforward, definite language in the registry of deeds, because these clowns they call lawyers don't look any further. You can have a whole bunch of stuff over here in the Board of Health records. Forget it. They're not going to look at that. If it's in the registry of deeds, it counts. If it doesn't, it doesn't count.
Well, I guess we'll let him know, and if he wants to come back to the board, he's certainly welcome to.
Yep.
Yeah, I think he's got to make a case. I'm not buying it so far.
Stop a lot of nonsense, for God's sakes.
Here. All right, moving on from 985 Main Street to 96 Hudson Road. What's new here? This seems like a regular.
Well, I don't know if you recall when the engineer showed a breakdown of what the overall potential uses would be of the property.
Yeah.
There was the a vet office. There was discussion of 2 single-family dwellings. So one has been constructed, and we have application for tying in a second. And I don't know if you've seen the email from Mike, but apparently on agricultural property, 2 single-family dwellings would be
If they
allowed.
can prove who's ever living in that second dwelling is living there and working on the farm. So in this case, I would have to defer that to someone else to say, is that considered farm? Was he using the words interchangeably? I don't know. I know when I asked Erica briefly, 2 single family on 1 lot, the answer was no. So I think, and then I spoke with, when I talked to Mike and I said, I just need to clarify. But I said, maybe the board doesn't go forward with approving or disapproving of a permit or, whatever information Bill has. But he said, just because the board would approve septic going on a property doesn't mean someone could build on it. Just like somebody could say you can build a house here, but doesn't mean a septic can go in, a septic and well can formulate there. So he did indicate that just, whatever's spoken about here may not, doesn't necessarily mean the end all that, we're approving that. Or
So walk me back
so-
a little bit. Is this the old
Equine.
Girl Scout campground?
Yep.
Yep.
Yeah, the
Okay.
Equine Center.
And so they built a house. I assume Brett and his wife have built a house themselves and are probably now looking to build a second house. Now, again, me as a kid growing up in this town, it's not uncommon. There's 2, Nancy Case lives up on Morgan Horse Farm there, and there's a little, barn keeper's house in the property. I'm getting think what else, what other property would I think of it does that? So no, I mean, so I guess what I'd say is this, I'm not adverse to it, but again, I think it is critical to make sure that it meets whatever zoning requirements we have in town, and that it's actually there for what it's supposed to be there for.
Yeah, I think you bring up a good point, Kristen. We're being asked to issue a septic tank permit that would allow this proposed home to tie into the existing system, which has been shown that the existing system could handle this flow. So our portion of it's pretty simple. But at the building permit application time, if there was a zoning issue with Mike or an issue with Erica, obviously the
And
building
they would be brought
would
up then.
move forward.
Yeah, no, I agree, Bill. Let's not sign anything that can be used as a cudgel against somebody else later. So I would agree with that.
The definition of the farm, we'll leave to somebody else, because that has been long and drawn out. One of the things that's come up, if you're keeping and breeding horses to produce colts, you are a farmer. If you have a riding stable and you aren't breeding mares to produce colts, you're not really a farm. You're a riding stable. But I'm gonna leave that up to Mike and Erica and all the people who are smarter than us.
And
In
then
the meantime,
they
the
may have already zoned it as what
Pardon?
is also speaking about, part of the lot to be sectioned off with frontage. Could that make, again, I wasn't, I was just trying to get the overall simple questions. Can 2 single family homes be on a property? If yes, then how? So because this is sort of a gray area with it being a farm. But again, I think that there are other departments that are certainly going to wait, depending on where they want to put the home. If it's too close to conservation land, then that's, they can't do that. So
we can accept the flow, period. Let everybody else worry about whether or not it's legitimate.
Right. All right.
Bill, do you know how far they've gone with this process? Like, should I be expecting a building permit soon from them? Or is this just something they're talking about in the future?
Well, I think when we looked at the proposed flows, it was kind of in the future, but I assume if they're moving forward with this, they have, Dillis and Roy have provided me a plan that shows the proposed house,
Okay.
shows it tying to the existing, what was the public water supply well, and putting a tank in to tie into the existing sewer line. The fact that they're moving forward on that means to me they're probably ready to do this.
Okay.
Sounds like Mike, Erica, and that organization have some work to do.
Agreed. All right. moving
So is the
on.
board, do you want to hold on the septic tank permit until there's
Yes.
further clarification?
Yes.
Okay. And
Because
I
again,
also, I spaced out as usual. I work meeting to meeting. I didn't have the engineer forward the plan to Kristen. So at least next meeting, maybe we'll have more info and a plan to share on the screen.
That'd be great.
yeah, that sounds fine. Like I said, I don't, I appreciate what they're doing there. I'm frankly, I'm all for it. But again, it's got to be legit. And then also don't want to be that board that, we've always been very sensitive to make sure that we don't approve something that can be leveraged against somebody else at a later meeting or situation. So,
No, I have no objection to it. Just legal beagles may make real hay out of this.
yep. All right, 56 Powder Hill Road. The hell's going on there?
They sent in, we had a past meeting from October. We had, the Title V came in saying that there was presence of a garbage grinder. So I
Mhm.
wrote a letter.
Oh, I
on
saw, okay, so we saw the plumber, the Mike Gill's,
Yep.
okay,
Removal of garbage disposal. So
okay,
sent that in to me. This is dated 5/21, so
Excellent.
can go ahead, Bill, and we'll issue if the
Yep.
board accepts that, issue a standard letter.
sounds great. Okay, that brings us to Lot 5, Goose Pond Path. I really hate that name, but just really, but that aside, is this something we need to take a look at, Bill, or is just some
Well,
minor-
again, failing to have the engineer email the plan, we could bump this to next. I don't think it's time critical, but
Okay.
this is a house that's under construction at the end of the cul-de-sac. And apparently when the tree clearing was done, either they didn't clear enough or it wasn't staked, obviously. So they're actually sliding the system maybe 10 to 15 feet. So I always like to see a red line. It's all sand and gravel out there. I told the engineer probably not an issue moving away from the testing a few feet, but to show us a red line. So we do have that, but obviously the board would probably want to see it before saying okay to it.
and they're not
I
going to
don't
be
think I
triggering
got
any-
that. I haven't gotten any.
No, I really didn't even have a chance to get in touch with the engineer today, so I can give them a heads up and get that set for next meeting.
Okay, and no variance being triggered by this.
Not to my knowledge, nope. If anything, it's moving further from property line.
Okay, excellent. Moving on, building permits. Bill, you signed all of these. Anything to note, comment, or?
Nope, 440 Stover Road was a result of the discussion with the owner and the engineer's review of the system that allowed that additional room to be added. Oak Trail is just a detached standalone garage. And the John Powers and Goose Pond Path are both finished basements, both because they're 5-bedroom designs, do not trigger deed restrictions, but both I think are going to require ejector pumps. So we just need to take a look at those pump specs before the pump's put in.
Okay, excellent. Which brings us down to septic permits, 51 Green Road, D-Box, and 42 Palmwood, the sewer line, I assume.
Actually, both are done. 51 Green Road was kind of a fast track. Person had the house sold in a couple of days, so we got the report, had the D-Box replaced, and this is just a follow-up on the paperwork.
Great.
With that report, there was also a requirement to pull the water filter backwash discharge from the system. And again, because this guy at his house sold, I just told him verbally, pull it, give us documentation. So all that, everything's done is the bottom line. We just saved those steps of sending a letter and getting the written documentation. I
send a
think I
letter?
forwarded that to you, the email, Kristen.
I will look.
But if not, I have it.
But I need to send a letter to follow up, or is it, are we?
No, because we never sent an, and bottom line is it's done. In
We
fact, I sent an
sent a-
email to one of the bank's attorneys just clarifying that we had the information and the Title V was complete. So we kind of bypassed all that.
Efficiency is what we're going to call it.
And 42 Pinewood was a sewer line from house to tank that was discovered to have either a crack or a low point. Homeowners were having issues, so it was replaced with Schedule 40 pipe. That was kind of a call when they pumped the tank. They did it while they were there, type of thing. So I gave them,
Sure.
and I did inspect it. So we'll have that paperwork squared away too.
Okay, so that brings us down. So 51 Green Road, obviously a pass.
Yeah, that had the
Uh,
D box above. Yep.
In terms of inspection reports, so 125 Harvard Road and then Sunset Ridge.
Yep, both of those were passes. Sunset Ridge is, that every 3-year cycle for the that type of a project.
And have we, and so it seems like we have, for a lifetime, we haven't heard any complaints about odors or rot of boxes or anything down there. I mean, so is
Nope.
things kind of settled out down there?
The boxes have been replaced. Hopefully, the additional venting's helping that. And yeah, I do know someone that lives up there, and they do say occasionally they get the odor, but I guess it's nothing like it had been.
All right.
Yeah,
That
don't
brings
jinx
us-
it, Chris.
Yeah.
What's that?
I said, don't jinx it.
Exactly. I was just saying, it's one of those things that it comes back around. I'm like, what? It was a while ago. All right. Well, that brings us to the end of our agenda. Does anybody else have any Board of Health business to discuss?
Just one thing, I was hoping I would have the results from taking a water sample from the stream as it goes under the Houghton building to see hopefully a vast improvement. And unfortunately, Neshoba Analytical did not get the results back to me today. I hope they'll have them in 2 weeks.
Yeah.
So I'll brief you on that when they arrive.
Sounds great. Exciting stuff. All right. Well, I've got nothing nothing to add. So and that's the truth. If that's Scott, anything?
No, I
Bill,
make a
any?
motion to adjourn.
Nope.
I'll make that a
Second.
second. All in favor?
Aye.
Fine.
Aye. All right. We'll see you guys in 2.
Good night.